You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In Podcast by Nurse Junior and Anthony.
You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In Podcast, episode 1. I'm your co-host / nurse, Junior, and to the right of me we got...
You got it, Anthony. Happy to be here, man.
Yes,
Happy
sir.
to get started,
Yes, sir.
baby.
It's been 4 years. It's been in the works, but we're finally here and we're getting it started.
Yeah, man.
So, this podcast, we're just talking about educational things, our history, different stories. We plan to get guests in the future. They'll pretty much talk about their stories and what they go through in the nursing profession. Ooh, nursing, it's a very... I don't know how would you say it? It's a dark space.
It's a dark space. It's very give and take. I feel like there's a lot of good days, a lot of bad days. You never know what to expect. Obviously, as a nurse, if people are coming to see you, it's usually not their best day.
True. True.
I mean, I guess it depends where you work, but a lot of dark days, but a lot of good days though.
Yeah, and to be a nurse, you got to be like mentally tough.
Absolutely. Absolutely.
I've seen a lot of nurses get beat up and
just beat down, man.
Yeah, mentally, physically, emotionally. So it's wild. So in this episode, it's just a little bit of an introductory. Let's start with you. Let the audience, the fans, know who you are, how long you've been in the game for, specialty you work in, and why you even became a nurse in the first place.
Yeah, so my name is Anthony. I'm an RPN here in Windsor, Canada. So I've been in the game for about 6 years, since 2018.
Okay. Pre-pandemic.
I was excited to get into the profession because someone we both know actually had kind of mentioned it to me. At the time, I was playing basketball at the university. I was in my undergrad, and I didn't like the program I was in, and I just decided to take a year off.
Mm-hmm.
My parents weren't too happy about that, but I took a year off. I did some traveling, kind of trying to figure out what I wanted to do. I knew I wanted to be in the healthcare space, but I didn't know how. And I had a roommate by the name of Stella. Shout out Stella Bolombo.
Shout out Stella.
She kind of had said to me, man, like, you love traveling. You know you want to be in healthcare. Why don't you try nursing? And I'd never thought of it until then. And after that, I put a lot of thought into it, started looking into it. I gave it a shot. Some years later, here I am, still in it, still enjoying it. There are dark days, like we said, but truthfully, I do enjoy it. I have fun with everything I do, So
yeah,
I think it's just really, really, I have a lot of fun with it. So, but yeah, that's pretty much me in a nutshell, man.
So you said 5 years in the game, roughly, give or take.
Yeah.
And then what specialty?
Oh, so at the moment, in inpatient surgery, so pre, post-op, and then I've done telemetry, cardiac. I've worked in like urgent care setting. I've done public health overseas. So a little bit of everywhere, and I did like a quick stint in a nursing home too.
Okay, wait. You said overseas. So where overseas did you go?
Yeah, so me and my lady, who's also a nurse, Angela. Shout out Ange.
Shout out Angela, and shout out to her. What's that? The new business that she got going.
Shout out to Rajeunir. Let's go.
How do you say it?
It's a French word. It's called Rajeunir.
Oh, bonjour.
Yeah.
Voulez-vous coucher avec moi? Ce soir. Yeah, I know my French.
Let's go, baby. Let's go. So it means rejuvenate.
Okay.
So for any ladies that are in the Windsor, Essex area, I hope I'm good to plug my girl, If you need fillers, Botox, any of that good stuff, hit her up. She's on Instagram, man.
For sure. So tune in, tap into that. Continue.
So shortly after I finished school, my girl wanted to do some travel nursing. She's an RN. and I was down because, like I said, I love to travel. So it made sense. I traveled to Australia that summer with some friends. And so we were able, originally the plan was to get contracts, go for a year, have some fun. And then the pandemic happened.
Or like they call it now, or they did call it the bandemic.
Oh, bro. Just crazy. So that happened. We like to tell people we got stuck there, but really we just enjoyed it there. The money was amazing. We made some really good friends. So over there with the pandemic, a lot of public health jobs. So we were over there for 2 years. I worked public health, just some stuff with the government, mostly like quarantining and just making sure, obviously COVID, where we lived, we were zero COVID. So the goal was to remain that way. We did for 2 years, which was awesome. But yeah, that was pretty much it, man.
Okay.
And we had some babies and moved home,
Yeah, I hear that.
Yeah, man.
Hear that. So y'all stayed in Australia for how long?
For 2 years. 2 years we were there. So Ange worked for the CDC, had an amazing job there. I worked for the government of Darwin, or the Northern Territory. Sorry, we lived in Darwin. Yeah, man, just beautiful weather.
Beautiful
What
weather.
about yourself, man? What brought you to the profession? How long? What specialties?
So my name is Junior. I've been a nurse for about 8 years now. Started off in the neuro ICU. Did that for about 2.5 years. In the neuro ICU, for people that don't know, you're dealing with brain issues, neurological problems. A lot of individuals that come in with acute strokes, seizures, gunshots to the head.
Crazy, man.
Motor vehicle crashes or accidents. It's wild. And this was in Detroit, Michigan.
Yeah, that's right.
The wild west side.
Super wild west.
Yo, the amount of crime, and it was crazy. So I did that for 2.5 years. Straight out of school. I think I was maybe 22. Fresh out of school, fresh in the game. 22 years old, neuro ICU. 2.5 years at that. Then I transitioned over to the pre-op PACU area. I was probably one of the youngest ones on that unit. So PACU, for individuals that don't know, that's a post-anesthesia care unit. You go into surgery, come back out, and what we do there is we recover you. By recover, I mean make sure everything went well with the surgery, pain medication, pain management, make sure you're not nauseated, education, teach, and then we get you the hell out of there.
And then you come to me.
Yeah, and then you go, or you go to him if you're in-house.
Yeah.
So did that, and then from there I transitioned over to. It was the pandemic. The pandemic hit.
Shout out pandemic.
Shout out to the pandemic, man.
It's Rona.
So did the pandemic, was in Texas, Dallas, Texas to be exact, with an agency called Crucial. Did that for a couple months, stacked my bread up there. Then I transitioned over to, where did I go next? I think I went over to.
What did you do in Texas, Junior?
Well, that's for another episode. Honestly, we'll talk about the pandemic and what really happened. You feel what I'm saying?
Absolutely.
If you know, you know, and if you don't know, you will know in a couple episodes.
Oh man!
But when I finished over in Dallas, I went over to California for a month. After California, went to Atlanta for a couple of days, and then they sent me over to Louisiana, which I was there for about 10 months.
Yeah. Damn, that's a long time.
This is a long time, in Louisiana. Beautiful place, by the way. Yeah. The food, magnificent.
Yeah, I've only been to Nolans.
Oh, yeah.
I love the food there, man. Big boy like me love the food.
Yeah, I love it. After that, kind of took a break for a bit, and I went over to Alaska for a year.
Yeah.
That's a story in itself as well, too.
We're going to talk about that,
We're going to talk about that one, too. But that's pretty much all the specialties I've been a part of as of right now. And
So in Alaska, where were you at though?
I was in a small town called Barrow, Alaska.
Right. And then what department were you in?
So I've never worked ER in my life, but when I got there, they kind of threw me in there. And I just had to learn on the fly, essentially. Yeah. So I did that, and I did, I guess you could say med surge, but they call it inpatient. Okay. It was a very small facility out there, 8 beds in the surgery side and inpatient side. ER, they had about like 4 rooms, maybe 5, very small.
Holy.
And then they had a labor and delivery side, 2 rooms.
Wow.
So they don't typically do a lot of births there. Okay. They do, but for the most part, a lot of the, I guess you could say the Native Americans or the Aboriginals, however, they rather fly over to the main city, which is Anchorage, Alaska, and give birth there. Wow. Because it's more safer, more resources. If anything goes down south, you know, they can bring you back up north, down in Anchorage. They can stabilize you faster than we can. Yeah. So, we were a very small facility, not a lot of resources, not a lot of bodies, but we had a good team and we got the job done out there. Yeah. But yeah, we'll talk more about Alaska on another day because there's a lot to talk about.
There's a lot to talk about.
And then, why I got into nursing. For me, I didn't even know I wanted to be a nurse first and foremost. My mom was the one that kind of pushed me to go in it. Right. She's a nurse herself. And for me, initially I wanted to be a chef. I think we talked about this before. But the problem is I couldn't cook a damn thing. couldn't even cook ramen noodles.
Shut up, ramen.
Yeah, man. So my mom, she like whenever she makes me ramen noodles, man, she dices up the onions, the jalapenos, just sautés, course, tosses it in, and it tastes magnificent. But mine's, it does not turn out like that at all. Yeah. So she's like, you can't even cook noodles. Well, why do you want to be a chef? I'm like, touche. And around this time, I think I was in the 10th grade, and we had days where we had to meet with our guidance counselor and let her know what we wanted to be, or at least what we're training towards. Told her I wanted to be a chef, and she wasn't really interested in what I had to say. I don't even think she was interested in what anybody had to say. I went to a predominantly black school, so black kids back in the day at that age were on our cell phones, headphones in. We don't give a damn. We just want to get in and get the hell out.
Absolutely.
So granted, maybe the students prior to me, they gave her no attention, which led her to not give me any attention. Mm-hmm. So she just wrote it down. Okay, you want to be a chef? All right, cool. You can leave. Told my mom about it. She said, nah, go back to that lady. Tell her you want to get into nursing. I go back the next day. I tell her I want to get into nursing. And she's like, well, currently right now you're doing applied courses. Right. It's more so of like low level intensity course. Like it's low level. Yeah. The workload isn't as tough as someone who's doing like academic or enriched.
Right. I feel like applied is geared towards kids in high school that are planning to go right into the workforce.
Yeah, you could say that. Yeah,
is what I remember it being. Mm-hmm. But sorry, I just wanted to.
No. I appreciate that. So I was in that. Like the 8th grade, I put no effort into school, which led me into going into applied courses. So, she mentioned how, you're in applied, and to get into nursing, you kind of have to be at a higher level. I'm like, okay. Took that information, brought it back to my mom, and my mom essentially came down to the school, talked to the principal, and was like, hey, I want my son to be enriched. Mind you, I'm in the 10th grade, and the principal goes, this is what I can do. Once your son gets to the 11th grade, which is next year, we'll put him in academic. We'll see how he does there, right? How he adapts. And from there, if he does well, we'll put him in enrich for the 12th grade. And that should help set him up to get into nursing school. So that's what happened. 11th grade comes, honor roll, did well. The work wasn't that hard in academic. It's just you have to apply yourself.
Absolutely.
12th grade, I'm in enrich now, and the workload was a lot, but once again, just apply yourself. So my average going into nursing school was 84,
Right.
which I thought was amazing. Now the three universities that I was trying to get into,
Yeah.
first one was McMaster's, second one was like Ryerson or U of T. I want to say Ryerson, and then the third one was Windsor, Windsor University.
Right.
That one was just whatever. I just threw that one in the mix.
Right.
McMaster's, the average to get into that was like a 94. Ryerson was like an 88. Windsor, maybe a low 80 at the time.
Right.
It's probably increased as of right now.
Absolutely.
So then get into the first two, and I'm like, damn. But I got a letter to Windsor, so I'm like, you know what? A win's a win.
Yeah, yeah, for real.
So I selected Windsor, and that's where I went to school at. And no regrets, honestly. I'm glad I chose Windsor. It's opened up so many doors for me, especially because we're right beside the border, right beside America. So a lot of doors were open for me.
Yeah.
And yeah, that's pretty much how I got into nursing.
Yeah, man. That's beautiful, man.
How were classes for you in nursing school?
I mean, they had their challenges like everything else. I feel like when you get into nursing, it's not one of those programs where you can just like skip, think you're going to catch up, and then like you'll be fine after graduation, because I feel like once you start in the field, everything applies now. You know, like I feel like even when I was in clinicals, beyond theory courses, people were like, "Oh, we talked about this in the class," and I was like, "What did we talk about in the class?" And I was so confused because at times I just didn't apply myself all the way. So I wouldn't say classes were difficult. You just had to make the effort to get up and be there. And for us, because ours was like a 2.5 year program, it was a grind for 2.5 years. Like you had to be there every day, or else you were falling to the wayside. And yeah, that's just what it was, man. But you know what? One thing I really enjoyed about being in nursing school was the clinicals, because the in-class stuff is all great, but I felt like I really shined when we were in the hospital.
Hands-on,
Yeah, you're on that hands-on. You see how people interact with patients, other nurses, management, and that I felt in my element, right? And that is what the workforce is. So, I mean, classes were what they were, but it's the clinical that I feel like I really shined.
Yeah, no, that really separates a lot of people apart.
Yeah.
I felt like for me, it's really, I could, in the clinical setting, I separated myself a lot from my colleagues when I was in, on the floors.
Yeah.
When it came to the books, I'm kind of behind, Like I had to really step it up and thug it out.
Yeah.
But for you, in your class, let's talk about how many males were in there.
Yeah.
Were you the only male?
So in my clinical groups, almost every single time, yes.
Ooh, okay.
In some of my classes, maybe one or two, I was always the only black male in my classes.
Wow.
In the program when I was in school, I think there was one other black guy, and he was, I think, a year ahead. Besides that, man, I can't remember anyone, like not one. And even now, like working in the hospital,
it's the same thing.
It's the same thing. Like you'll see one here and there, but it's just so few and far between. Like so few and far.
So let me go a little bit deeper now. How many black men were in your program? Were you the only black male?
Zero. I was easily the only one. And if I am missing someone, I am so sorry, because obviously nursing is a big program, but man, I cannot remember a single person, a single black dude in my class at all.
Wow.
Yeah.
Yeah, looking back, well, for me, I need to look back really deep. I could probably say about 6 or 7 black male nurses.
Yeah.
In my program in all 4 years. I can name at least 6 or 7. Other than that, that's not a lot. And that's black males.
Right. This is a big program.
Very big program. I'm talking like students, maybe 300 to 400.
Right.
And in Windsor, it's a collaborative program. So, in the first year, there's probably about 200 nursing students.
Okay.
After that first year, it kind of declines because, people either fail out or it's just not for them.
Absolutely.
And then you move on to second year, it goes from like 200 to like I said, 150, maybe 140, maybe even lower.
Yeah.
Then you hit third year, and now the college, St. Clair, collaborates with the university and they come together.
Right.
Now the sample size now increases exponentially.
Right.
And then you'll probably see a decline once you hit fourth year because maybe people fail out and maybe it's still not for them.
Right.
But at the end of the day, it's about 200 to 300 students within the program itself.
Right.
That's how it was for my year. But yeah, about 6 or 7 black males, honestly.
Yeah, that's crazy, man.
That's a low percentage. Even in today's generation of nursing or era, I don't see that much black males.
Oh, man.
I work in Detroit, Michigan, and granted, there's a few black males, but the sample size is still too small.
Right.
Compared to like other races like Caucasians or some Asian males or whatever the case may be. But black males, there's
why do you think that is, though?
Honestly, I think, and let's move back to high school. Right. So for me, I went to a predominantly black high school in Rexdale, Ontario.
Right.
So in Toronto.
Shout out Rexdale.
Shout out Rexdale. That's the hood.
If you didn't live in Rexdale, you knew about Rexdale.
Exactly, in some shape or form. So it's a predominantly black school. Like it was in the hood. Yeah. Like I'm talking, you walk in the bathroom, they shooting dice, they gambling.
Right.
Police are coming to our school almost every day because of a fight. Something. Yeah. Someone brought a gun, something.
Yeah.
So I think with my school, they didn't really push that agenda to say, hey, y'all need to get into the healthcare field. Maybe they didn't know.
Right.
But for the most part, it just wasn't on the agenda to push the sciences with us a lot. I mean, we did have to take biology, chemistry, and all that, but it just wasn't on the agenda. And coming from where I come from, you don't really see a lot of black male doctors.
Right.
You don't see black nurses, male nurses. You don't see black lawyers, engineers. I'm not saying that my neighborhood never produced any of those. They probably did, but they probably got the hell on out after they finished school and moved to like the suburbs.
For sure. So
growing up, if you don't see it, you don't. There's a part of you that believes that you won't achieve it or you just won't know about it.
Sure.
Thankfully, I had my mom who's in the healthcare profession at the time, who pushed me to go into it. But I didn't really have any role models in my neighborhood. You see the ball players, you see the trappers, you see the hood dudes. Mm-hmm. You just see just negative. I'm not saying basketball is negative, but like, the other stuff that I mentioned, the trappers and all that, Absolutely. It's very negative. And if that's all you see, you're going to want to be that.
Of course.
They pulling up in the fanciest cars and all that, dressing in designer. So you're going to gear towards that more so.
Right.
So I feel like if my school had something like a career day where they bring in a black nurse or a black doctor, engineer, lawyer, whatever the case may be, to talk to us, it'd probably be a little bit. It would shift the agenda a bit, but I think that's where it comes down to. But at the same time, I will say that it's on us as black healthcare professionals. We need to go back to where we're from and
Absolutely.
Educate the youth. Let them know, like, hey, this is possible. You can do it.
Yeah. This
is a 6-figure income profession.
Absolutely.
If you really put your mind to it.
Right.
So that's a little bit about where I come from. But how about yourself? I think with high school.
Yeah, so high school for me, I mean, growing up, so I'm African. We came straight from South Africa, or emigrated, I should say, straight from South Africa. So growing up we were a little bit lower income. However, my father's a physician, so by the time I got to high school, he was finally certified, was able to work.
Okay.
So we lived in the suburbs in high school. And so for me, it was opposite, like completely opposite than what you just described.
Polar opposite from,
Right? So my school, for example, had 1,600 kids. Of those 1,600 kids, there was maybe 5 black kids in the whole school of 1,600 kids.
What's the name of the school?
St. Anne's Secondary.
Okay.
So and don't get me wrong, my dad was a phenomenal role model. I have in the house. He's a physician. I think when you're that young, you want external kind of people to model from. And I didn't see black people around me by the time I got to high school. I didn't so it wasn't even like, apart from my dad, it wasn't even like I didn't have there was just nobody there, right? So yeah, I see my dad. Unfortunately, I would have loved to attain where he's at, but I would have loved, like you said, someone to come talk to me and see what other options there are, kind of give some sort of guidance, to see kind of where I could go. You know what I mean? And an example of that, like my little brother recently graduated law school, and that's what he did. So there's a program, I guess, there now for people of color. I can't really remember what the program is. And my brother went back and he talked to a bunch of these kids to kind of show them what's possible.
So that sample size increased with African Americans?
So it has
Africans?
it has increased. They've even like made a club because they kind of understand they're still in a minority.
Yeah.
And they just want to do better, right? Like they want to be better. They want to kind of they want to reach their peak and see what they can accomplish. So they've kind of made this club, and through that, my brother went and talked to them and kind of showed them what could be possible, you know? So it's cool. So that's something I'd love to do as well.
Okay. That's good to hear.
Yeah.
That's good to hear. Okay. So now we're going to talk a little bit about the African culture.
Yeah.
You know, I'm a Nigerian. I'm Nigerian.
Yeah.
You're Congolese, right?
Yeah.
When it comes down to the African culture, growing up, our parents pushed these 3 powerhouse careers, which is being a lawyer, a doctor, or engineer.
Absolutely.
With my case, thankfully, my mom she's chill. She's cool. She's not like that.
Yeah.
She's not, you got to be a doctor. You got to,
Yeah.
Growing up, there were instances where she would buy me a book, like a math book.
Yeah.
And if you don't get this certain percentage on this page, you can't go outside and play with your friends.
Yeah.
And I'm scrolling to the back looking at the answers, but I ain't even showing my work.
I remember those.
Yeah. So that was a big thing in African culture, and a lot of other ethnicities or races wouldn't even know about that. Maybe a few, but for the most part, not really. But so for you, I'm just curious. Your father was a doctor,
right?
How was it in your household? You have 4 other siblings.
So 4 siblings. There's
total of
5 of us total.
Yeah.
My pops was really cool, man. My pops, I love him to death. He was always the type to say, whatever you do, I want you to be the greatest. Just be the best at it.
Right.
It doesn't matter what you do. Just be the best at it. However, I think when his first 4 kids didn't go to be a doctor, a lawyer, engineer, there was some sad nights in his bedroom, So I love him to death. I don't think he'd ever admit that. But, he shot 1 for 5. My youngest brother's a lawyer.
Yeah.
Honestly, I'm really proud of my little brother. It's great. So, but in our house, like I said, even though there was that, what my dad was saying, just be the best, there was always that undertone, like, these are your options.
Yeah, these are yeah.
You know, be the best at whatever you want to be, especially if you want to be a doctor, lawyer, engineer.
Right.
You know?
But I love you more if you do these 3.
Yeah. So, yeah, like I said, I love my dad to death. He's never said it. It's just one of those things you just know, like you need to excel.
Okay.
You know?
I mean, at least he got a switch, right?
Of course. He got one, baby.
He got one. He's 1 for 5. So,
that's
I mean, it's positive. It's positive.
That's it, man.
Yeah. So, yeah, I mean, I already explained my situation. My mom was super chill about it. Went into nursing. But I will say that my first year of nursing was probably the most toughest, honestly. You know, like I said, predominantly black school. I feel as if they didn't really prepare me for the real world of university or nursing school.
Okay.
You know, like I said, went to University of Windsor, and I was away from home.
Yeah.
Had no family.
Yeah.
My mom, my brother stayed back in Toronto. I just didn't have the resources, or what's that other word? The
circle.
Support system.
There you go. Yeah.
I didn't have the support system.
Yeah.
So there was that. I stayed in one of the noisiest residences in all of campus, which is Mac Hall. Shout out Mac Hall. Mac 7 to be exact. If you know, you know.
No.
Bro, Mac 7 was probably one of the most... It was the party floor. Like every year there's a specific floor that's the party floor, and that one was the party floor. So I couldn't get any studying done.
Yeah.
Everything was just difficult. Every night there was just music blasting, people coming in and out. It was rough. So near, like probably halfway during the semester, I had to just live in the library.
Right.
You wouldn't see me throughout the day. You would only see me coming back home probably after midnight.
Right.
Excuse me. So that was that. Now, classes for me, I was struggling. I'm coming into class late. I'm dozing off.
Yeah.
And the teachers, are, like, specifically one teacher, she's just targeting me.
Yeah.
Asking me questions. For example, I could be in there minding my own business, and someone taps me on the shoulder and is asking me to borrow something or to do something. Automatically, boom, Junior. I'm like, yo, well, yes, miss. Yes, professor. What is the nursing process? And I'm like, she won't even give me like 3 seconds. I can't even collect my thoughts at this point.
Right.
Oh, you don't know it? All right. Amanda, what's the nursing process? And Amanda will spit out the whole thing.
Of course.
Assessment, diagnose, implement. I'm like, wow.
Yeah.
Wow.
Yeah.
You gonna do me like that? Plan, implement, evaluate. I'm like, okay, cool. All right, Junior, you gotta be on your game. Come on. And so she's targeting me every class. I could be dozing off. Junior. Like the whole class knew my name at this point.
Sure.
Now, at the same time, I do respect her for doing that, because at the end it made me realize that I need to focus.
Sure.
So, you know, by the time midterms hit, my grades were garbage. Like to the point where I'm failing. I gotta figure it out quickly.
Right.
So, you know, I'm doing my best. I start to go to Alumni Hall, which is probably the more upper echelon of the dorms.
I remember.
And this is the one thing that pissed me off about this school, and specifically there. They had a specific floor designated to nurses.
Right.
I didn't know about that.
Right.
Granted, it's more money to be included on that unit or on that floor. I would have figured out a way to pay it off down the road. But if I had known, I would have rather be there than where I was originally.
Yeah, absolutely.
Just because it would have helped me out academically.
For sure.
They even had like a little sim lab on that first floor.
That's a difference, bro.
A baby sim lab where you have like your own stethoscopes, or their textbooks are there, blood pressure cuffs, so like you can practice.
Right.
I didn't have that. Like I had to go to the actual total hall and go to the second floor and work in the health assessment labs just to practice.
Yeah.
So I didn't have any of that. But anyways, halfway there, I started studying with them a lot more. But at that point, it was too late, man. I had failed 2 courses.
Yeah.
Intro to nursing, I got like a 58% or 59%. And anatomy and physiology, I got want to say like a 56.
Right.
So anatomy, honestly, I deserve to fail that. But intro, I felt like there was hope, like, you know?
Right.
So what happened was I had, and for people that are listening right now, in nursing school, you have 3 strikes or you're out.
You're out of there.
You feel me? Like,
Yeah.
so me, I was already on 2 strikes.
Right.
And when you fail 2 courses, it's like the equivalent of, let's use sports as an analogy. Imagine starting a basketball game. It's the first quarter and you're already down by like 25 points. There ain't no catching up. You're not going to want to put in the effort to try and catch back up. Or even if you do try, you're already so far gone.
Absolutely.
You feel me? So at that point, I felt defeated mentally.
Yeah.
Now I'm moving on to, it's the end of the year now. We're end of the semester. I go to the nursing building. And my plan is to essentially talk to both of the professors. So the one professor I'm talking to, I won't say who's who, but
Right.
talking to one, and she's kind of, you know, empathetic, showing me a little bit of sympathy. Junior, you know, you can do better. I know you can. You just got to put in the work. But I would like to see you back next year, and hopefully you can get it.
Yeah.
You know? I'm like, miss, come on. Is there anything I can do? Like, I only failed by so-and-so. Like, any extra credit, any assignments, something.
Yeah.
Unfortunately, there's nothing I can do. Granted, she could have mentioned, what's it called? An appeal process.
Absolutely.
Because what I went through in first year, it was pretty tough. Like I said, I didn't have the resources. I didn't have, you know, family, friends around me to help pull me up and help me. Even my diet was garbage. Like, my meal plan ended within like 3 weeks.
Yeah. That's how
The way I ate, bro, I got that freshman 15. I was a skinny body, but you know, I toned up. But like that meal plan was done.
Yeah.
So like my eating, wasn't exercising as well. Didn't have the resources, the family to help support me.
Yeah.
And she's, you know, she didn't bring any of the appeal process up to me.
Right.
So I'm like, anything I can do, miss? And she said, no, nothing. I'm sorry. You just gotta come back next year with a hard hat and get it done.
Yeah.
At this point, I'm pissed. Like, I'm just cussing on my, man, fuck all.
Yeah.
Piss me off. So now I'm walking over to the other professor's office to kind of see what she can do for me.
Right.
I'm talking to her, and she wasn't that sympathetic or empathetic for me. It was like hard to the bone type shit. Like,
Right.
I'm going to her, and I'm like, miss, is there anything I can do? You know, I failed by so-and-so amount. Any extra credit? Like, something. I'm sorry, Junior, there's nothing I can do. Honestly, you had your chance, you know, you had ample amount of opportunity, but you know, there's really nothing I can do. What about, no, Junior, there's nothing. I can't look over my midterms, or like, she's like, for what? Look at your midterms for what? You had your chance.
Yeah.
You had your chance months ago to look at your 2 midterms. What about my finals? Can I look at my finals? Maybe there was a mistake. No, there's no mistake. I'm sure there's no mistake. You just gotta come back and redo. Yeah. I'm like, miss, come on. I already failed 2 courses. 1 more and I'm done. I'm finito.
That's right.
Nada, nothing. And she's like, honestly, if you feel concerned about, you know, failing another course, I would consider you maybe transferring over to another program if you feel like you're at risk of failing again and losing out on money and ray-tay-tay. Bro, I was pissed.
Sure.
I was pissed. And the way she said it, like, the tone, like I remember it till this day. Like, I wanted to just pull down her book, her bookcase, knock the notes off her paper, and just turn Hulk. Yeah. But I knew campus police would have been on my ass, and I would have been in handcuffs.
This nigga said,
God damn it! So yo, I was heated. I just got up and I'm like, all right, bet, cool, whatever. Right. Walked out. I'm just angry at this point. I go back to my dorm, and I'm just laying down on my bed crying. Tears are just dripping for 2 days straight. I was supposed to catch a Via Rail to go home that same day later on in the afternoon. Supposed to take the Via Rail, go to Union Station, from there hop on the subway all the way to Kipling Station, take the 45 or the 46, whatever it was, you know, to Kipling, and I'm pretty much home. Yeah. I said, no, I can't do that right now. Like, said, F all that.
Yeah.
I'm just laying there for 2 days straight. Phone on D&D. I know my mom was calling me. Actually, my mom was calling me, and I didn't want to answer. I didn't want to tell her.
Sure.
I eventually told her when I did leave 2 days after, and, very supportive. She said, don't worry, you got this. Most African parents, they'll scold you.
Absolutely.
And then, the love will probably come down the road later, or it may not even come at all. You just got to figure it out.
Scold is a very gentle word.
Yeah, very gentle.
Yeah.
And then you got to figure out the emotional part you got to handle the emotional part on yourself.
Absolutely.
But for my mom, she supported me throughout the whole process, completely from beginning to end.
Yeah.
But yeah, I get home, she can see I'm depressed. Got my little brother coming up to me saying, hey, let's play. He hasn't seen me in months. Mm-hmm. I'm just like, yo, Sam, not right now, man. I need to just relax and really reflect on life right now.
Yeah.
A few days after, I kind of get over it, but it was a rough time. And what made it even rough is that the next semester, as you know, probably, the next semester, when you fail, you got to do your electives. So like stats. I picked up on doing what is it called? Intro to kinesiology. I did those type of courses, chemistry. Mm-hmm. And, for some of those electives, you're still there with some of your peers from nursing school, but you're not doing the core nursing courses.
That's right. So for those of you who don't know, if you fail in nursing, it's not like usual programs where you can pick up where you left off and just keep going. You pretty much have to take your electives and then redo the semester that you failed with the whole new class incoming. And then now you're kind of with them and you kind of go from there.
Yeah. So you can imagine me, like, I wasn't embarrassed, but I was more so embarrassed of myself that I'm not continuing on with my peers.
Of course.
But, they see me in the electives, but they don't see me in the core nursing courses. Mm-hmm. So now the whispers are happening, and they're like, yo, is he not in our class anymore? Did he fail? What did he fail? Like, what's going on? And you got some people coming up to me, hey, we didn't see you in this class, and what's going on?
Yeah.
Man, stop asking me stupid questions. You know what happened. Let's be honest. You know what happened.
Yeah.
Like, for real. Like, cut the cap. Like, you know what happened.
Of course.
You don't see me. Like, rumors already been circulating.
That's right.
You guys know.
They gotta know.
They just gotta know.
Yeah.
Some are making assumptions, but they just gotta know.
Yeah.
So I'm upset at myself, but thankfully I had a few friends like Puneet, Keith, Avneet, a few individuals that helped support me throughout the process, and whether it was sharing notes, uplifting me in certain times when I was down. So shout out to them.
Yeah.
And then, so at this point, I'm still trying to figure out if I'm going to continue on next year and redo those courses that I failed.
Right.
So I go back, like, this is the end of the semester. I go back to the nursing floor to talk to either one of those professors that had failed me in the course. Both of them aren't there.
Right.
So I'm walking out, and all I hear is, hey, Junior. And I turn around, I'm like, looking over, where'd that come from? It's a professor in one of the rooms. She goes, have you decided what you wanted to do? Like, are you going to continue on? And I'm like, honestly, that's what I came here for, to kind of discuss my options. Kind of on the fence of potentially not coming back due to the fact that, the amount of money that's been spent and the risk of failing that third course. Like, there's just too much on my plate right now.
Yeah.
She goes, come into my office, have a seat. This is Professor Paff, by the way. Shout out to Professor Paff, amazing woman. She's my Florence Nightingale.
Yeah.
She's the Florence Nightingale to me, my generation, because she pulled me out of the gutter for real. Like, we sat down, we talked for almost maybe 30 minutes, and talked about how we can execute, or how I can execute and potentially, do well next year. Have a better supporting cast with me. She gave me resources without even me asking. Books. One book had like a scratch code where you can scratch it off, get the code, log into the actual website of the book, and do practice questions. So she was very supportive, and she said, you know what, you can do this. You have the ability. I'm looking at you, and you can achieve this, honestly. And honestly, at the time, I think she said that she didn't really know anybody that had failed 2 courses, or maybe she did, but they didn't continue on.
Right.
But to like fail in that first year for me and to continue on all the way to 4th year, I thought it was impossible. But she encouraged me and said, it's not impossible. You can do it. And if no one's done it in the past, I know you can do it.
Right.
So that was all I needed to hear. So, that summer I went home. I cut myself off from like almost all my friends and just focused on working, stacking up money.
Right.
Because I just failed. The amount of money I lost that first year was just exponential.
Right.
Worked 3 jobs. I worked as a sitter. I worked as like an aide. That job was pretty lit because I'm chilling with patients that had dementia and, having conversations with them. 10 minutes later, who are you?
What's your name again?
Yeah, what's your name? What are you doing in my house?
Where am I?
right. So, that was crazy times. I did that, and I also worked as a in the factory.
Yeah,
that was crazy. I think the factory was the exclamation point in my life where I need to get back into this program and actually finish.
I've been there
because it's like, damn, the amount of like. Kudos to the factory workers.
Absolutely.
People that immigrated from different countries. People that have like records that can't even get an actual good job. Whatever the case may be, they're in there working.
Right.
Like working. And there was points where like my supervisor, this Jamaican guy, he was pushing for me to get fired. Like he said, he's not going to make it here. He's not going to last. He's mentally weak. And I think that's actually what helped me to finish nursing school a little bit because he mentally pushed me. Honestly speaking, I wanted to quit that job. I'm like, Mom, I can't do this shit.
Yeah,
this is too much. You're working from like 3 p.m. and then you leave until you finish the job until they say you can go home.
That's right.
Some nights it'll be like midnight, 3 a.m. You go home, and I'm taking the bus back home, bro. It was crazy, but I stuck with it. And school started back up. And then I typically went back to that factory every summer just to stack up bread. Right. But that's pretty much what it was. And then started back nursing once again.
Yeah.
Went to Alumni Hall and, tried to introduce myself to some of the new nursing students. One of them being your wife, Angela. Yeah. Shout out to her. She helped me a lot too. Who else was there? There's Andrea, Taylor, Jade, Antoinette, shout out to Antoinette. A lot of them actually pushed me in. I made it. Yeah, graduated.
Let's go.
Okay. So what about yourself? How was the nursing school journey for you?
Yeah,
from beginning to end?
So for me, it kind of started in undergrad. A little bit similar to yours. So I was playing basketball at the U.
Yep.
I didn't live in res, but I was renting a place. And, man, there was a lot of partying around me.
Was it Rankin? Were you on Rankin?
No, I was on College and Campbell area.
Okay.
But we were on Rankin a lot. So, because the basketball team had a house on Rankin.
Yeah, they did.
I was there a little too much, unfortunately. To my demise.
Yeah, I remember some of the hoopers. Shout out Josh Collins. Living in Abu Dhabi and shit like that.
He just had a baby, too.
Congrats to him. I remember Junior Osentola.
Oh, shout out to Junior, man. That was
Rico, yeah.
Yeah, man. So, like I said, a lot of partying. So, I went into AP, so academic probation. Both semesters my first year. And I was like, damn, I can't sustain this, bro. I'm doing too much. So I worked hard. I got out of AP, and then again, I did another year, all good. Not great, but trying to right my wrongs from my first year spilled into my second year.
Okay.
So when I switched programs or was going to switch programs, they were just like, yo, your marks are horrible. Horrible. And like you said, like, I think by that point, there was a standard to be admitted into the nursing program that I didn't meet.
Yeah.
So I was like, what are my options here? You know, like this is a program that I want to do. So they were like, yo, you can go to St. Clair, you can do a pre-health program out of the U for a year. You get good marks, you can come back. And I found out while I was there, you need like all A's.
And this is in pre-health.
This is pre-health. If you want to get to the nursing program, no B's. It's all A's. So I was like, all right, no problem. I really, really, really buckled down. All A's. Came back. I apply.
Yeah.
I get accepted. And then a lady hit me up and was just like, yo, I know we accepted you, blah, blah, blah. But like, you were in AP for a whole year here. We can't accept you. And I was like, I already have my acceptance letter, blah, 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 blah. Knowing what I know now, I probably would have appealed that too and tried to fight that because I did what I was supposed to. Regardless, I had asked her on the conversation, I was like, what am I supposed to do? Like, I'm a year removed. This is the program I want to do. So she was just like, yo, you could take the RPN program. We can get you into that at least. You do well, then eventually you'll be able to bridge over. I was like, dope. So I did the RPN program. And even that came with its challenges, man. Like, it's a lot of information in 2 years.
Right. So compressed.
Yeah. So it's a very compressed program. Very challenging. A lot of people failing out as well. Wow. And again, I had my challenges with that as well, but I had a really, really, really good friend there. Her name is Bree. Shout out my girl Bree.
Shout out Bree.
Yeah, man, me and her just studied together. We were really close. She really, really was my rock and helped me move along, you know? So, yeah, man, and a couple good teachers, too, that gave me some advice along the way, but eventually we got there, and now we're here, man. Wow. So it's a blessing.
Yeah, man. No, it's honestly a blessing. A lot of people don't make it out. A lot of people of our complexion do not make it out.
Absolutely.
Of nursing school into the real world. So
absolutely.
Shout out to all the black males out there.
Yeah, man.
Black nurses, just nurses in general for making it, because it is a struggle at times.
It's a grind.
It's a grind for sure. But, you know, to the future nursing students out there that are thinking of getting in, you know, one thing I will say is you just got to focus. You got to set yourself around some good souls that actually want to thrive and want to make it out. So just team up with people. Always communicate with your professors.
Absolutely.
Office hours is a key thing. Make notes all the time. Make notes. If you go into a lecture, I would even say pull out your cell phone and just record, because I mean, when you're typing and making notes, sometimes you may miss something.
For sure.
So now you can go back in your phone, listen to the audio, and be like, okay, she said that. All right, cool. Boom, 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 boom. Got that jotted down.
Right.
All that is important. Needless to say, you can do it, honestly, because if I did it, and he did, you can do it.
Anybody can do it.
If you can achieve and you can believe that you can pass. So
yeah, man.
That's really what it comes down to, honestly.
Yeah, man, and I agree with you. Like, just surround yourself with good people and people that are focused. I mean, at the end of the day, it's only 4 years of your time, man. You get it done. Life is a little bit better on the other side.
It really is, and you'll thank yourself for actually going through with it.
Right.
And like you said, life is better on the other side.
Yeah, man.
For sure. So we'll wrap it up there for episode 1.
Absolutely.
In the Scrub Me In Nursing podcast.
Yeah.
And yeah, hope you guys enjoyed this segment. We hope to bring you more episodes, and stay tuned in. Make sure y'all subscribe on YouTube. That's one thing. Subscribe on YouTube. Follow us on Instagram and Scrub Me In Podcast.
Yeah.
TikTok, we on there. What else is there? We're gonna have the Facebook page come up. Mm-hmm. We on X is what they call it.
Let's go.
Shout out Elon.
Yeah.
We on X, or Twitter as they used to call it.
Yeah.
But yeah, follow us on Instagram. Follow us on all the socials. We'll have it posted up. But thanks for tuning in. Peace.
We'll see you soon.